Governor, thanks so much for having us in your lovely office here. Really appreciate your time.
Thank you for coming.
Your probably your biggest win of the session was a new permanent universal childcare program here in New Mexico.
It's my big win in 8 years.
Yeah,
It's a long time in coming, and thank you for recognizing it as the achievement that it is.
No doubt. And, there was some back and forth throughout the session, debates, amendments. There was a call for wealthier families to pay copays. A version of that did make it into the final bill. How do you feel about what lawmakers got to your desk?
I feel really good. Look, my preference is still, you don't need copays in a system. It's not universal then. It can be better than it is anywhere else for access for working parents and families, but you create equality in a system, right? When everyone goes. And, public education, even for its downsides, and there are some here in New Mexico still, you want it to be available in the same way to everyone.
And so it's not. How does that feel?
So I didn't want it. But consensus is about productive compromise. So here's what they did. They said, look, if there's a downturn in the economy, right? States, including this one, have had to make really tough choices, including they cut education in the last administration because we didn't rebound from the 2008 recession for a long time. So if we have an economic downturn that's got fair measures, right? It can't be a moment, can't be one gas price, it can't have oil by the barrel drop to 50 for a month or two. These are sustained problems over a year. Then the department can institute copays.
Right, so there's these triggers.
There's triggers, and those triggers are at 600% of poverty. There's not a state anywhere in America that gets anywhere close to that. Really leaning in, I think there only may be a couple of states that even get you to 200% of poverty. Childcare is too expensive for any working American. It was too expensive in New Mexico for any working New Mexico family. That is now gone, and the most valuable thing is that when you have a universal system that has public and private child care programming, it means that it will always be accessible. You will always invest to build it, and that we don't have any of those failures that some other states that have sort of nibbled around the edges, including California.
You're bringing it up right now.
Yeah.
How do the communities across New Mexico meet the new demand for now free or at least low-cost childcare? What does workforce development in this space look like?
Well, we are 67% to the good as compared to the rest of the nation. And actually, I want people who challenge us. And so thank you. But for every naysayer that said on November 1st, there is no way you can build this system when we have gaps. Well, 13,000 plus children later, I would tell you we did exactly that. And we did it by investing in a workforce at the same time, by doing the training at the same time, by allowing the certification of home-based providers, by not picking one kind of system like public schools or faith-based or private or nonprofit versus profit.
Bit of a patchwork.
It's everything. And I wouldn't say it's a patchwork. It's a smart design that allows parents to have choices and for providers to have the kinds of systems that they're comfortable in running and having available in a community. So we met the need. Now the second part, meeting the need in a much more flexible system. More certified workers, more in a career path, more new buildings for childcare, because we're learning things, the country is, the state is, about the best way to teach or support a 2-year-old in a brand new childcare system. There's different tools and techniques, and all of that gets built into a brand new structure, which is why we're paying for those structures and low interest loans. We're building as fast as we're delivering. I think New Mexico is the model for the rest of the country to follow, and I assure you that's happening.
And if that's the case, let's envision the future after this is implemented. New Mexico has for years been too too often at the bottom of negative lists when it comes to childhood well-being. What do you envision universal childcare to do to all of the various measures that go into that?
Well, we're already seeing what it's done. I mean, we did pre-K first, and we also then lifted, right? So we had free childcare for a lot of New Mexico families, because until November, we were at 400% of poverty.
Right.
So we're taking children and families out of poverty. We're number one in the nation for moving the needle further and faster than any state in America's history. So we were 50th, to your point, and now we're 21st. Right? It's all of these investments. The number one indicator for child well-being, whether it's going to be good or bad, is poverty. What happens when you're in poverty? Trauma, stresses, family instability, drug addiction, alcohol addiction, high-risk environments. All of that gets attenuated. Is it always all gone? That's an impossible standard. But we are seeing those outcomes. Another one, and that's just pre-K.
Right.
73%, roughly, maybe just a little under. So says UCLA, of New Mexico's kindergartners are beyond where they need to be in order to be ready to learn in kindergarten and in elementary school.
And so do you see that starting to trickle forward to our third graders, fifth graders, eighth graders with those different tests?
Yes. And in fact, we've seen bigger gains in New Mexico than the Mississippi Miracle in terms of what we're seeing in our grade schools in literacy jumps. Are we there? No. And did our mid-schoolers get free childcare and free pre-K? They didn't. And did our high schoolers? They didn't. So you're going to see gaps that we're working on. We're not ignoring mid-school and high school. That's why we now have it literacy mandated for everyone everywhere. But the things that you must have as a state, you must address poverty, you must address crime, you must address behavioral health. We're the only state in America that eliminated behavioral health access for, nearly 8 years in the state, and then had to deal with COVID. We got every kind of risk on top of risk that any state has ever had to deal with, and we've tackled all of it, and I am feeling better than bullish. Childcare really is about making sure that working families can stay at work and make the choices that they've always deserved to be able to make. But I believe unequivocally, to your point, I really want to hit it hard because you've been the first person to really get there. This is going to impact risk in New Mexico and child well-being. And we have waited 100 years to do all of the things all at once. You can't just do a piece of it. You have to do all of it. And then you have to sustain it. And what did this legislature do? They did it for 5 years. It's a 5-year funding model. They have to kind of say yes again every year. But we showed that we can fund it at this level for every infant, 0 to 3, for 5 years between general fund and the trust fund. This is something no state has ever achieved. And if I sound really like I'm leaning in and proud, make no mistake, I am. And I think bipartisan, the legislators who built this along this 8 years.
The Immigrant Safety Act was another really big bill this year. Counties must end their contracts with ICE for immigrant detention as soon as practical. Any word on whether private prisons, like CoreCivic, for instance, may contract directly with ICE and continue operating within the state of New Mexico?
I think with what happened in America and in Minnesota, I think the federal government is going to be careful about what they do. I can't promise New Mexicans that they won't try to do, private prisons. We won't run, the state won't contract with a private prison entity. We do it ourselves. We've taken over 2 private prisons, and I think our outcomes, in fact, I can show you the data, unequivocally better, as they should be, right? We have a constitutional duty to keep prisoners and inmates or folks in jail safe and to meet their basic human needs and to provide those services with dignity. I find more often than not that the feds don't pay any attention to any of those constitutional requirements, and it's the reason the state has leaned in the other way.
Okay.
They could also still do contracts, these counties, with U.S. Marshals for real for criminal offenses, not civil offenses in detention. So I don't see this as a be-all to end-all to prevent federal work in a corrections or detention framework, but they cannot take a misdemeanor for immigration and place someone into those facilities with very little oversight or attention to human dignity and their constitutional rights. That ended.
When we spoke to you during the session, you spoke with Gwyneth Dolan. You said if this step wasn't enough, you would find other ways to protect New Mexicans. How will you know if more is needed? And to your point about what the state actually has the ability to do, federal immigration falls very squarely under the federal government's purview. So what can you do, and when will you know if more is needed?
Well, if we'll see what kind of contracts these counties engage in with either the U.S. Marshal or some other entity, to your point. So I'll know, right? You can't actually operate a facility without us knowing. Two, they have to get licenses and certifications and permits for healthcare and any related number of activities. I'll know about that too. We won't issue them. And three, I do think it's a fair issue for counties to say, look, you never paid us for regular detention in a number of ways. They run all the jails and we detain individuals pending, right, a trial, and we don't pay you. So we got just under $7 million to reimburse all counties for work that we haven't been doing. Now, I've been supportive of that since 2019, and I couldn't get that into the budget. The legislators finally responded, thank you. But in addition, we did just under $12 million to replace this. It's only for a year, but to replace these ICE detention facilities. This should not be the only economic development for a rural community. We want them to start thinking about better ways to support New Mexico workers in better long-term economic efforts. And I think this is a good effort for them to engage in. Let's do more rural healthcare delivery in these counties. So I think the state's in a good spot currently, but will the feds reach in directly? I assure you they will, and we're going to be watching.
All right. Speaking of things that you have wanted for years that are finally getting done, I do want to talk about a little bit about the rocket docket that you had done. You got 3 bills passed very rapidly through the legislature. We've discussed them at length on this show. It was civil commitment law updates, the road bonds package, and interstate medical compacts. Why were those the items that you wanted to see happen as quickly as they did? Well,
because they feel like emergencies to me. Look, our roads are not safe. People are paying on average $1,000 in car and road maintenance, and we just had a very lengthy discussion about poverty in the state of New Mexico. I want this to be the most affordable place with no poverty, right? We don't want to meet any of those standards. That should be every governor's goal. I need these roads fixed, and we need some stability. Well, otherwise, we lose whole industries like the contractors that can't afford to even buy the equipment or even get loans for the equipment unless they know road money is coming.
Now, road money in particular, you got $1.5 billion through. The Transportation Department has said that they've got $7.5 billion worth of unfunded programs. So how do you prioritize? How do you meet that need?
Well, that's done by the Transportation Commission and by the feds for matching. So we have a really good, robust process I'm really confident about that's transparent. So you can go online and take a look and see if your road is in there or your interchange. And so can legislators, and they get interim reports routinely. But it isn't enough money. And I will tell you that the next governor is really going to have to lean in and look at other short and long-term financing mechanisms to make sure that you have sustainable funding for roads. And likely in the next, if you have a governor that succeeds his or herself, you're going to need well more than $7.5 billion. You're probably going to need closer to 20 in that 8-year time frame. And they're going to have to do things like debate a gas tax and debate other recurring revenue streams. And they've done that a bit, but I think you're going to see more of that because I think we successfully made the case. Give me the bonding. Let's get these big priority roads done. Let's get the matching money from the feds. And then you all in a 60-day session can identify every short and long-term financing vehicle that the state is going to need. And then we have been debating danger to self for years in the state. And so that's been something the public's been involved in. We've done it in special sessions. We've done it in regular sessions. And it doesn't, I got competency addressed, but without danger to self. And the real debate is we were debating it in a healthcare context. We needed to be debating it in a legal context. It's a legal definition, right, for legal capacity.
Okay.
All right. It's not about your behavioral health issue. It's whether or not you meet the legal definition to be able to make a concrete decision for yourself. And you have to meet a narrow, serious danger to yourself or others, right? It is not about being unhoused.
What do you say to people who shudder at the idea of involuntarily committing people who haven't been prosecuted for a crime?
I think that they need to realize that there are parents and individuals who are living on the streets or, in unstable, really unsafe housing. What we're basically saying to people who have serious mental illness is we don't see you. You can be in an at-risk, you can be trafficked. You can be the product of years of self-medication because nobody provided you the service. And we're going to look away. It's the cruelest American situation I have ever seen in my life. And there isn't a family impacted, including mine. This is not a treatment scenario for people who are not dangerous to themselves and others and cannot make a decision about treatment themselves. And I think finally people realize that our decisional making capacity, that's the legal definition, was 20 years old. And I say to the same community that now supports assisted outpatient treatment, that it took 16 years to pass it, because you should take seriously that being committed to any service program or institution when you don't want to is something that requires serious, right, evaluation and a judge who is trained with then mental health professionals who all agree that's the only option. And when we passed it, there's no accountability. So if you walk out a day later, hurt yourself or kill someone else, too bad. We're the last state in America to realize it can't be all of one and none of the other. I think this is the right approach in the right way. And if it isn't, and I don't believe that it's not, you have a 60-day session to then make, adjustments if you need
Tweaks
them.
can happen.
But we needed to do something, and I'm really glad that we did.
And then finally, medical compacts were part of that rocket docket.
They were. Thank goodness, too. Social workers and docs, I wish they'd passed many more compacts. But again, these have been debated for more than just the last couple of sessions, and they've been in the interim. And I did the rocket docket in 2019. I took 40 bills that had nearly unanimous support by the legislature. These bills did, and were debated in the interim multiple times and had been vetoed by the former governor. That's not a judgment, but they were. And it seemed to me that if they had been debated and in a legislative context litigated over and over and over again, and people still wanted them and they were relevant, why don't you just get them into one committee referral, since they've been in every committee multiple times, haven't substantially changed, and give a governor a chance to sign them and all the new things? Then they don't get bogged down in the committees over and over again, and they never get debated.
And as you said, it's been a successful tool for you. Do you think it's replicable for your successor to use this kind of tool?
I hope so.
Okay.
I mean, every gubernatorial candidate should be talking to legislators right now about what ought to be on a rocket docket, where it should start, and they should commit to voters right now that they plan on getting 5, 10, 50 bills signed in 2 weeks that show that they're ready to govern, they're ready to lead, and the legislature is ready to support
And what
them.
should they say to voters who say, well, if it's ready to go in 2 weeks, that means that most of the work happened behind closed doors, or at least not within view of the public after the session gavels in. They were basically ready to go.
They are. I mean, I think that people, given the federal government, have every right to feel anxious about what government is doing or not doing. We have a really good, transparent process with webcasting and required interim hearings and all of that, and the bills are online for people to see. I mean, it really is easier in New Mexico than it is in most legislative arenas in most other states in America. Just building consensus doesn't mean that there's something underhanded or not transparent. And I think we have to maybe with your work, people need to embrace that a little bit better. Consensus building is happening all of the time. It's not
and
just...
that's what's not happening in the interim hearings that are on,
They
that are
are
streaming?
They are happening. You can go, you can look it up, you can see what happens. You can call, you can do an IPRA. You don't need an IPRA. You can call an agency. You can call your legislator. They answer their phones. Their cell phones are online. If there's an issue that you feel has never been discussed, likely it has, you can find out about it. You can call my office. I really find it to be very transparent. I would argue that it's so transparent and that every New Mexican can weigh in, that sometimes it creates sort of this burden of influx of information. That's far better than not having public input at all. But this rocket docket's a good idea. It doesn't mean that a brand new idea doesn't get fully vetted in a legislative session. Those are going to get 3 committee referrals. Those are going to be debated, and likely they don't quite get over the finish line, and then you'll see them all year long before they get returned to another legislative session.
I do want to move us on just in the interest of time. We were just talking about compacts. A lot of Republicans were arguing early on in the session, those compacts don't matter much without medical malpractice reform. This was yet again something that you had been calling for years. You got a version of it done this year. A significant part of the call behind medical malpractice reform was these high insurance premiums that doctors were facing. What guarantees do we have that with this, now the law of the land, that we'll start to see those premiums go down for providers?
Right. Well, I would love to tell you that every bill I sign, I guarantee is going to have the impact that we believe it's going to have. If I could do that, we'd never need another legislative session. Everything is just fine. You need multiple sessions. But here's what gives me great confidence. We were such an outlier in occurrences, in punitive damages, in unlimited liability, in the lowest level burden of proof to bring punitive damages, that there was no review panel, that it became a strategy for the highest possible settlement. Had very little to do with proving out whether or not you had a legitimate malpractice claim, which meant then nobody would sell insurance here. And their payouts were so high that we were such an outlier that those premiums, because that's how insurance companies can guarantee they can pay it out. They charge you more.
So are they gonna lower things? I mean, I don't think insurance companies are necessarily renowned for lowering the prices of things. Yeah.
Well, but the difference now is we're not an outlier. So more companies will sell. We're more competitive. And if they don't, now you've got a bad faith insurance environment. That gives you a different set of legal tools. And more importantly, if you have more physicians and more healthcare practitioners in the state who are all collectively buying insurance, that changes the marketplace. It's going to be driven by the private sector, but it's not impossible that the next governor is going to have to say, here's what will happen if you won't sell insurance in the same way you do in Colorado and in Arizona and in Nevada and in Texas and in Oklahoma and in Louisiana and in New York and in California. I'll sue you. And that's what's going to happen.
So there may be more steps to come.
And hospitals will do it and the MCOs will do it. So I'm pretty bullish. I'd like it to happen tomorrow. We'll have to wait and see about how long, but I'm feeling as good as you can. And the most important thing about what we've done is that physicians didn't want to practice here, wouldn't come and wouldn't stay. That climate changes rapidly, in my opinion, because of this law.
And now it wasn't all wins. You had some big wins this session, but it wasn't all wins.
Let's just do wins. Come on.
I got to switch to some of your losses, including the Clear Horizons Act.
Yeah.
That was a biggie. That was meant to solidify in law your climate goals that you set out early on in your tenure as part of executive order. That didn't happen. So how do you feel potentially leaving office with those goals still simply being executive orders that are really at the whim of the next governor?
Yeah, well, I'm feeling as good as you can. I mean, I want to do a couple things. I was really interested, so I want to really highlight the courage of the pro tem. I had a bill ready to go that's just the codification. Because in the ETA, which is just utilities, right? Not the executive order that mirrors the Paris
This is the
Accord
Energy
agreements.
Transition Act.
Energy Transition Act that says that utilities have to get, right, they have to reduce their carbon footprint. And by 2050, they have to be net zero, but they have to be 80% of the way there by 2040. Right? So every industry, we have a lower standard that meets the national or international community standards for doing something about the climate crisis. I think it's better often to be less prescriptive about how you get there. I mean, we never would have considered that fusion would be in that mix and thereby sort of giving us new carbon-free opportunities in our energy delivery just 3 years ago. It wouldn't have been in the mix. I think you want to be a little more flexible here. The pro tem and her courage and the courage of
This
environmental.
is Senator Mimi Stewart.
This is Senator Mimi Stewart said, because we're going to get a new governor, maybe, and because we're in a political environment for the next governor and the next set of statewide electeds, let's be a little more prescriptive about what government has to do to each sector, transportation, agriculture, all businesses, in order to meet that climate goal. And I think that really is hard to do in a 30-day legislative session. So I was going to not fight as hard and do just the codification, but she's now well poised, isn't she?
Yeah, what will it
and
take
the
to pass
legislators.
it? I mean,
I think the next governor, a 60-day session.
Stewart lost some Democrats. I think 7 voted along the lines with Republicans to defeat it. So how does this end up getting passed next round?
We need businesses to have a coalition for support. And they maybe need to be less prescriptive about how you get there, but they have to be fair about what that is. I mean, what she did in this bill that was really good, that I don't think enough people know about, is if you're below 10,000 metric tons of carbon in a year, you're exempt. It is harder for smaller businesses. This is not to tell New Mexicans that we don't care about those emissions. We care. But she created an on-ramp, if you will, for those smaller industries that may not have the same tools available to move beyond that as quickly as everybody else. And the big actors is where we want the biggest reduction. That's why we focused on oil and gas and utility sector with both our methane rules and oil and gas and ozone precursors and the utility sectors first. I don't want them investing in dirty energy, right? We focused in a place that would give you the biggest benefits. She really had a smart design. I think we'll see what we need in the 60-day session.
All right. Public safety. You had a signature gun control bill fail. That was Senate Bill 17. You have prioritized public safety, crime fighting more broadly throughout your entire tenure as governor. And I wonder if you see this as I do, that it has become a real sticking point within the Democratic Party.
Yes.
In New Mexico and maybe more broadly. But how would you like to see Democrats proceed in this space?
They have to own that we have a public safety problem in New Mexico. And yes, some of these numbers, just like they have, including murder, homicide stats, are looking better. But when you are so high, like insurance, if you're an outlier, these reductions aren't enough. We're still an outlier. When people aren't safe, when I've got schools for threats and actual guns on campus nearly every week having to close, statewide. We got a real gun problem with young people and guns in general. Here's the problem, I think, with the Democratic Party in general, is that we are the party of, and I'm proud of that. That's why I'm one of the multitude of reasons. We tell the truth. We're evidence-based. We believe in science. There is real work behind doing exactly how you started this interview. There is evidence about reducing risk, reduce poverty. People need jobs. They need a fair chance. You have to reduce risks. You have to have real behavioral health services. All the things that we know make a difference. But those in a vacuum will never be enough. Just like if you tried to arrest every person for everything, we're going to arrest everyone who by accident drops a gum wrapper. This is not going to make any of us safer. This makes no sense whatsoever. You have to do both. You need real accountability. You need real measures for safety. And you have to keep leaning in to root causes of crime. And what I end up with by the Democratic Party around the country and here is you pick one or maybe the other.
And it's the root causes that they're picking?
They're picking root causes, but we have done a mountain of work that they should be really proud of. You should be doing the same thing on the public safety side.
You think that'll resonate in the midterms?
I believe that it does. I think I am not the DNC, and I can't predict to you how Americans or libertarians and independents and all folks who are not registered Democrats are feeling about a number of these issues.
Sure.
But unless you feel safe in your community, businesses aren't going to keep coming. People will move out of their neighborhoods. We're not going to be able to redevelop. We're going to continue to have real risks. You have to do it. You know where kids get guns? From felons who have possession of guns. You know where felons get guns? By bad actors who sell them to someone legitimately in a straw purchase. Why do we think it's okay for someone who clearly isn't allowed to have a gun to keep perpetuating our gun problem? Why do we have the lowest incarceration rates for the highest risk offenders in America? It doesn't make any sense. I don't think people feel like the Democratic Party is doing a disservice in Arizona or in Colorado or in California or in Washington State or in Oregon or in DC or in New York. It's happening here. You have to reconcile. It is never one or the other. A robust, holistic way to lean into democratic values is to show that the investment in our values will make a difference short-term and long-term, but accountability should not be partisan issues. Those are common sense solutions that are required always, and you should be right-sizing it all of the time. That's my message to New Mexico Democrats.
Okay. By the time this airs, your last regular legislative session will have been officially behind you. You've signed what you're going to sign, and you're leaving office at the end of the year. So what else, as the executive, regardless of what the lawmakers will do in partnership with you, what do you want to get done for the rest of the year?
Well, I want New Mexicans to know that I've got a robust set of priorities between now and just over 9 months. I need to do my math.
Yeah, something about that, yeah.
One, I want all of the things that we need to finish building, like the Literacy Institute. I want to walk through those doors. And we've been spending billions of dollars in our communities. I want to finish all the safe water investments, as many as we can. We want to finish a good, really easy for the community, the New Mexicans to engage in. I want to make sure that that's completely transparent for these capital projects. I want to do another stunning increase this summer. So let's beat 17,000 kids in structured literacy tutoring. Let's add, I'm going to go big, another 10,000 students, and let's have another double-digit literacy increase, and let's see it take hold in mid-schools. Let's announce again a stunning increase in graduation rates, and not just be where everybody else is at 80%. Let's get to 87 or maybe even 90%, showing that we can get huge things done in just 9 months. Let's get more kiddos into the reading at grade level in mid-schools. Let's have more of our challenge classes for mid-school boys and girls who are typically our high dropout rates. Let's show child well-being in the context of CYFD. We've had a stunning positive record in CARA. Let's not have one slip up. Oh, that's a hard thing to say that we'll do. It won't be for lack of trying. That means the whole of government is going to keep leaning into those issues in CYFD. Let's get more high-performing hospitals into that high-performing range between now and the end of 9 months. Let's make sure that competency and danger to self are beginning to show real improvements. And last but not least, let's move people in to affordable houses statewide. We can build far more than 10,000 homes in a year. Let's make sure that we get to closer to 25,000. That's a really heavy lift, but if you don't set remarkable goals, nobody will do them for you. You have to set that up and create that kind of competitive spirit and that can-do attitude for New Mexican statewide, and that's exactly what I intend on doing.
Governor Michelle Lujan Grisham, thank you.
You're welcome.